Nursing Care of Substance Use and Addictive Disorders. Module 5, Assessment, Motivational Interviewing, and Family Dynamics. Substance use rarely exists in isolation. When a patient presents with a substance use concern, we are not just assessing what they are using. We are assessing safety, mental health, trauma history, medical stability, and support systems. As nurses, our first responsibility is always safety: airway, breathing, circulation, level of consciousness, suicide risk, risk for withdrawal. But once immediate safety is addressed, we shift into something equally important: understanding the whole person. Substance use is often a coping strategy. Our job is to assess without judgment and create space for honesty. When assessing a patient with suspected or confirmed substance use, we want to gather information in a structured and calm way. Start with open-ended questions. What substances are you using? How often? When was your last use? Have you ever experienced withdrawal? Assess for co-occurring mental health disorders. Depression, anxiety, PTSD, bipolar disorder, these frequently occur alongside substance use. Assess trauma history using a trauma-informed lens. You do not need every detail. You need to know whether trauma may be influencing behavior and coping. Assess medical complications: liver disease, infections, cognitive impairment, malnutrition. Assess social determinants of health: housing stability, food access, transportation, safety, support systems, and always assess suicide risk. Many patients with substance use disorder are ambivalent about change. That is normal. Change is difficult. Motivational interviewing is not confrontation. It is not convincing. It is not arguing. It is guiding. We use the OARS framework: open-ended questions, affirmations, reflective listening summaries. Instead of saying, "You need to stop drinking," we might say, "What concerns do you have about your drinking?" Instead of saying, "This is bad for you," we might say, "What changes, if any, would you like to see in your life?" We assess readiness for change without pushing. We meet patients where they are. For nursing students, remember this: resistance is not defiance. It is fear, ambivalence, or lack of readiness. Patients move through stages of change: pre-contemplation, contemplation, preparation, action, and maintenance. If a patient is in pre-contemplation, arguing will not work. If a patient is contemplating, support exploration. If a patient is preparing, help build a plan. Our interventions match their stage. NCLEX tip: always align your response with the patient's readiness level. Substance use affects the entire family system. Families may respond with fear, anger, overprotection, denial, or enabling behaviors. Some family members may unintentionally support continued use by covering up consequences. As nurses, we avoid blame. We assess family stress, communication patterns, and safety. We provide education about the disease model of addiction. We reinforce boundaries. We encourage family therapy or support groups when appropriate. We also assess for domestic violence or unsafe living conditions. Family involvement can improve recovery outcomes, but only when it is safe and supportive. Working with patients who struggle with substance use can trigger strong emotional reactions: frustration, sympathy, fear, and rescue impulses. Self-awareness is critical. We maintain professional boundaries. We provide consistent, structured, compassionate care. Compassion does not mean permissiveness. It means dignity and accountability together. Remember, relapse is common. It is part of many recovery journeys. It is not a failure of nursing care. Assessment is more than a checklist. It is a therapeutic interaction. Motivational interviewing helps patients move toward change at their own pace. Families need education and support. As nurses, we create safe, structured, non-judgmental spaces where healing can begin. In the next module, we will focus on the treatment continuum, recovery planning, and long-term nursing care management.